Hello once again, it's your next door nurse Florence and you're welcome back to my channel where we talk all about emergency health and wellness tips. In today's video, we're going to be talking about sleep apnea or sleep apnea, whichever one you want to call it. We're going to be defining it. We'll talk about the types, the signs and symptoms, the risk associated with it, and the treatment. Stick with me. Sleep apnea is a medical condition where you repeatedly stop and start breathing while you sleep. It is associated with decreased oxygen saturation in the blood. Sleep apnea occurs in about 3% of normal weight individuals, but affects over 20% of obese people. In general, sleep apnea affects men more than women, but the rate increases in women after menopause due to the decline in estrogen and progesterone. Estrogen and progesterone maintain airways muscle tone and keep it from collapsing. Sleep apnea can cause short-term sleep deprivation, which can affect mood as well as your safety at work or while you drive. It is also strongly linked to life-threatening chronic conditions like heart disease, stroke, high blood pressure, type 2 diabetes, and depression. If you snore loudly or feel tired after a full night's sleep, you might have sleep apnea. The number of times a person with sleep apnea may stop breathing can range widely from about 5 times an hour to as many as 100 times or more an hour for up to a minute at a time. Undiagnosed sleep apnea is often linked to heart disease and metabolic issues like diabetes. Therefore, it is important to treat sleep apnea. Repeated untreated sleep apnea ends up seriously damaging a person's brain and body by interrupting normal sleep and depriving the person of oxygen while they sleep. There are 3 types of sleep apnea. There is the obstructive sleep apnea, the central sleep apnea, and the mixed sleep apnea, which is also called the complex sleep apnea syndrome. Obstructive sleep apnea. This is the most common type. It is caused by blockage of the airway during sleep. In obstructive sleep apnea, the throat muscles relax and the person's tongue and soft palate collapse against the back of the throat during sleep, closing the airway. A noticeable sign of obstructive sleep apnea is snoring. So if you snore, you might probably just have sleep apnea. Central sleep apnea. This type of sleep apnea is rare. It is caused by the brain failing to send the right signals to the muscles that controls breathing during sleep. There is no airway blockage in central sleep apnea. Mixed sleep apnea, as the name implies, it is a combination of obstructive sleep apnea and central sleep apnea. The symptoms of obstructive sleep apnea and central sleep apnea overlap, making it difficult to determine which type you have. The most common symptoms of obstructive sleep apnea and central sleep apnea includes loud snoring, episodes in which you stop breathing during sleep, which would be reported by another person, gasping for air during sleep, awakening with a dry mouth, excessive daytime sleepiness, difficulty staying asleep, difficulty paying attention while awake, and irritability. Obstructive sleep apnea can be a severe sleep disorder if your breathing stops and restarts more than 30 times an hour while you sleep. Untreated sleep apnea can have serious long-term effects on your health, such as trigger mental health issues, poor immune function, contributes to memory loss, increased risk of high blood pressure, heart disease, stroke, depression, and diabetes. Secondary effects such as automobile accidents caused by falling asleep while you drive. The treatment options for sleep apnea includes breathing devices such as continuous positive air pressure therapy, which is the most common and most successful treatment for moderate and severe sleep apnea. The machine pushes pressured air into the airway while you sleep, preventing the airway from closing. Another device-based treatment option involves a dental appliance that people wear while they sleep that brings the lower jaw up and forward, helping to keep the airway open. Other alternative treatments to reduce sleep apnea symptoms includes 1. Maintaining a healthy weight. This can keep your airway clear and reduce sleep apnea symptoms because obesity increases the risk of airway obstruction and narrow nasal passages. 2. Exercise regularly. Regular exercise can increase your energy level, strengthen your heart, and improve sleep apnea. 3. Altering your sleep positions can reduce sleep apnea symptoms and improve your night sleep. For example, sleeping on your side instead of your back can improve your symptoms. 4. Use a humidifier. Humidifiers add moisture to the air because dry air can irritate the body and the respiratory system. Using humidifier can open your airways, decreasing congestion and encouraging clearer breathing. For added benefits, you might consider adding peppermint or lavender oil to the humidifier. These essential oils have known anti-inflammatory and soothing benefits. 5. Avoid alcohol. Alcohol relaxes the throat muscle that control your breathing, which can lead to snoring and an interrupted sleep cycle. I'm not saying that everybody that drinks alcohol snores. Anyway, let me know in the comment section below if you know anyone that drinks alcohol and also snores. Let's do our own little experiment. 6. Avoid smoking. Similar to alcohol, smoking can also contribute to inflammation and swelling in your airway. This can worsen snoring and your sleep apnea. 7. Surgery. Surgery that interacts and stimulates the nerve that goes to the tongue, producing a push forward of the tongue, or surgeries to remove the tonsils and or the adenoids. These surgeries, when successful, can actually get rid of the sleep apnea. So guys, we've come to the end of this video. If you find it helpful and useful, give me a thumbs up by clicking on the like button. Please subscribe to my channel for free by clicking on the red subscribe button. Also click on the notification bell so you'll be the first to know when I upload new videos. You can drop your comments, questions and concerns in the comment section below and I'll attend to them. I remain your next door nurse and I'm just a knock away. I love you guys. See you in the next video.